Hi, my name is Amy Brown and I'm a student nurse anesthetist at University Health Truman Medical Centers of Kansas City, Missouri. This is my husband Kevin, who's going to be learning about substance use disorder and the anesthesia professional. Why is the sRNA and cRNA at risk at developing substance use disorder? Substance use disorder is a real thing that can happen to anyone who's suffering from emotional stress. Although each person perceives a stressful event in a different manner, the responsibilities of a nurse anesthetist and student nurse anesthetist contribute to the vast amount of physiological tension that can affect mental clarity. Also, the medications that are used in anesthesia are readily accessed to. 1 in 10 anesthesia providers meet the criteria for a diagnosis of substance use disorder that work in a high stress profile profession. This is a universal crisis that needs to be recognized, as the impaired provider is not only harming themselves, but risk harming the patients that they take care of. Substance use disorder is a disease, not a choice. Research provides strong evidence that the dopamine areas of the brain are stimulated with the use of drugs and alcohol at higher levels than any other stimulant that produces pleasure. This reward pathway in the brain is a way for our bodies to adapt to the stressors, thus making it very difficult for an addict to simply stop. Substance use disorder is a disease of the neural pathways that have been rerouted to recognize substances used for relief as an innate compensatory mechanism. Those with addiction need treatment with professional care, as it can be life-threatening attempting to quit alone. Behaviors that can be identified as being under the influence include odd characteristic behaviors, irritability with drastic mood swings, aggression towards authority, elaboration of excuses, poorly explained mistakes, wearing long sleeves when inappropriate, taking longer than normal to complete ordinary tasks, and abrupt confusion or memory loss. Physical signs include bloodshot eyes, track marks on arms and ankles, or weight loss or gain. Behaviors that may indicate possible diversion includes voluntary overtime hours, finding syringe and vials and pockets in possession, frequent trips to the bathroom or extensive breaks, heavy wastage of narcotic medications after cases. Physical signs include anesthesia records not matching what was administered to the patient, inappropriate drug choices for the patient or case, missing medications, and patients with higher pain scores reported than other anesthesia providers. The AANA Peer Assistance Helpline responds to nurse anesthetists and students seeking help for substance use disorder, as well as colleagues or family members with concerns. Offered resources and support are in place to help individuals be evaluated for appropriate life-saving treatment. The AANA website is not limited to news and events happening nationwide with nurse anesthetists and student nurse anesthetists. The website consists of many resources, including wellness awareness for oneself and others, including, but not limited to, domestic violence, drugs and or alcohol abuse, physical and emotional wellness support. The AANA website has a specific section designated for utilizing resources that help those cRNAs and sRNAs with substance abuse. Anyone can access these resources, and I will show you exactly where to go in case we need to use them. There are several tools that are found under this section on the website that include the helpline phone number, as well as potential signs and behaviors of those using and diverting, intervention tips, and treatment recommendations. So here, if you go to aana.com, you will find the Health and Wellness Peer Assistance tab. And it's titled Getting Help for Yourself and Others. And here there are several hotlines for suicide prevention. And right underneath that is the drug or alcohol substance abuse. This helpline number is listed here, as well as the signs and behaviors to identify impairment and or drug diversion. There's also intervention tips and treatment recommendations. I want to point out that if you feel I would become hostile and defensive or potentially harmful to myself or to someone else upon confrontation, you can reach that ANA Peer Assistance Hotline 24/7 at 1-800-654-5167. This is completely confidential and not associated with licensure or certification. They can walk you through the next steps that you can take, offering advice and guidance on what to do next. Here is a physical copy of the ANA Helpline Peer Assistance number and also the website listed below. You can also use the QR code on your phone that will pull you right up to this website as well to find that information. I want you to keep that in your wallet in case you ever feel the need to use it and you can access it quickly. I hope this is something you or myself will never need to pursue. However, it is important that we acknowledge the possibility. Together, we need to make a plan of shared accountability that will identify risk factors to prevent myself reaching a point that I would feel the need to turn to drugs and alcohol for comfort. I need you to continue to remind me to keep a healthy balance between my role as a student nurse anesthetist and my role at home that includes being a mother, a wife, a sister, and friend. You are my person that can tell easily if I am overwhelmed or upset. And I need you to continue to be my shoulder to cry on and my ear to listen to at moments of defeat, as this is very crucial to relieve my stress. At any point you feel you may need more help to help me, please call the ANA Peer Assistance Helpline using the wallet card I gave you or getting online on this website at ana.com. I wouldn't be where I am today without you believing in me and supporting me every step of the way. Thank you for all the sacrifices you take to support our family while I am adventuring this path in our lives. I am so grateful for you and I love you, and I know that the next 2 years will probably be very difficult, and I need you to promise me you'll make sure I don't fall off that path.